Alright guys, welcome to our PoopScoop Monday. I had to make sure I get my audio in here, and thank you for joining today. We have a great show today. On today's show, we're going to discuss, let me go through my topics here. We're going to discuss how often you should poop. I know you had this question because literally all you guys asked me how often, what is considered normal when it comes to pooping. We'll talk about exactly what is dysphagia. If you're having this issue, you may need to come see someone like me. We'll discuss how to combat IBS during the holidays. We'll combat 7 reasons why your bottom hurts, and I'll give you reasons what you can do to get you taken care of, and we'll discuss any questions you guys have as well. So if you're joining for the first time, my name is Dr. Islam. Welcome to PoopScoop Monday, where every Monday we drop those knowledge bombs for your health to make sure you can live your best life. My name is Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic, currently based in Lubbock, Texas, where I work in my office, Lubbock GI. Come see us if you have any GI issues, for any issues going on. I hope you guys are having a great week so far. How was your weekend? What did you do? Let me know in the comments down below what you guys did. Did you guys have fun? Did you watch football? Did you watch the Cowboys play? My goodness, man, they're looking pretty good. I am kind of surprised. Knock on wood or whatever wood I had. Now, the Cowboys are looking pretty good as well. Let me know in the comments down below if you watched the game, what you did for the weekend. And what I want to hear from you guys is where you guys are watching this at. Are you watching this here locally or abroad? And are you watching this live on the replay? Let's see if we can get some people as well. So, Alexa, thank you for watching on today's show as well. All right, we'll go and talk about some of the topics today. So, question number 1, hey, Dr. Islam, how often or how long should I poop? I have a lot of patients who ask me this question because they're worried that they are not pooping normal, or that maybe they've been told they're not pooping as often as what they think they should be. So let me tell you a couple things. So number 1, it's okay for the occasional time to not poop as often as you normally do. But there's a lot of reasons, a lot of factors that go into play when it comes to bowel habits and constipation. So, for example, what you eat, how you're feeling, if you're drinking enough water, you have enough fiber, are you relaxed, did you have coffee? There's so many factors that come into play when it comes to having a bowel movement. Number 2, the most important thing is that what is considered normal for bowel movements is less than 3 per week. Say what? Yes, that's it. And so you don't need to be considered, you don't have to be pooping every single day for this to be considered normal. Nor do you have to poop every other day. In essence, the medical definition is pooping less than 3 times per week. If you do that, then medically, you're officially constipated. Excuse me. And that is very, very common. However, what's important for me is how kind of your poop looks, but also how you feel. That's more important for me. So we use a chart called the Bristol Stool Scale. This is literally a chart of your poo. It actually tells us how your poo can look, because you'd be surprised how many patients and how many people that I see really don't have a good idea what it means to be constipated or diarrhea. So this stool is on a scale of 1 to 7, and 3 to 4 is what's considered the golden poo. The poo that is exactly what we're looking for. That's long, that's well-formed, that has very little splash on it. That's the type of poo that we're hoping for, and that's the type of poo we want to aim for as well. Now, people can range, for certain individuals, depending on your conditions that you have, but typically, Bristol Stool Scale 1 and 2 is what we consider constipated, where it's very hard, lumpy, and it's hard to push out as well. But what's more important for me is not how often you poo, but how you feel. Meaning, you can poop every single day, and you can have bowel movements every day and still be constipated. Did you know that? It's a very common question or concern that a lot of us have. So what's important for me is, do you feel like you've had a complete bowel movement? Do you feel like you've emptied everything out? Do you feel like you had that, man, I feel good after I have a bowel movement? Because if you do, it doesn't matter how often you go. For me, your constipation is taken care of. And even if you go every single day and you don't have that sensation, for me, that tells me that you're having issues with constipation. We need to address this get this taken care of, get this resolved, and get you feeling better. And there are a lot of ways we can do this. Sometimes it's diagnostic testing. Sometimes it's giving some fiber supplementation, some magnesium, maybe the occasional stool softener or some prescribed medications. We have a lot of ways to treat this. But when it comes to constipation, don't focus on the number. The number doesn't matter. What matters more is how you feel. And do you feel like you're getting good bowel movements? If you do, then you should be good. Let me know in the comments down below if this answers your question about constipation, or do you have issues that you want me to address as well? Let me know in the comments so I can see what you guys are worried about so we can hopefully address this as well. All right. Once again, I want to thank you guys for watching today. My name is Dr. Islam, and yes, I am your poop guru. My passion is to give you guys the best tips and tricks so you can live your best life from the top all the way down to the bottom. Every Monday, I go live on my social media streams to answer your questions you guys may have about your poop, about your gut health, anything you can think of. Let me know in the comments if you're watching this live or in the replay, and also let me know in the comments where you guys are watching this at as well, and what social media channel you guys are watching this at as well. All right, question number 2. Hey, Dr. Islam, I've been told I have this condition called dysphagia. What is going on? So let's go into the medical lingo here. Let me get my little medical hat on so I can talk to you about exactly what I mean. So dysphagia means trouble swallowing. So what that means for me is that you are having difficulty with food getting stuck as it's going down. Now, there are a lot of different reasons why people have dysphagia. The most common reason is what's called a stricture or a narrowing in that esophagus. When you have an esophagus that's this big, for those of you guys who are watching the audio, I know you can't see my hand, but think of my hand as a circle, and it becomes narrower and narrower and narrower. That is whenever you can have a stricture that's forming, and that stricture very commonly can cause the symptom of dysphagia. Now, there are other reasons you can have trouble swallowing. For some people, you can have an allergic condition called eosinophilic esophagitis, very common condition, typically in young men who have recurrent food impactions or have trouble swallowing. They may also have atopy and asthma, so keep that in mind. That's how we know that they have this problem, and that's also another reason why you can have trouble swallowing. Sometimes it can be a problem with the way the muscles of the esophagus are working. A common condition that can cause that are things like achalasia or a spasm of the esophagus, which are problems with the motility or the contraction of the esophagus. Now, for a lot of my patients, the vast majority of the reason is a stricture, which is due to acid reflux. So you'd be surprised how many patients who I go see in the office to say, hey, I know you're having trouble. Do you have heartburn or reflux? And tell me, no, I have no reflux. Well, let me tell you, when we take a look with the scope, which is how you diagnose it, I can see that narrowing that's there, and I can tell you, you definitively have reflux, and you actually may have what's called silent reflux, which is a very common problem that you don't actually have the heartburn symptoms that you normally have, but you actually have what's called silent reflux, which that acid over time can cause narrowing and stricture to occur. Your esophagus is not like acid. It tries to do what it can to make sure you don't have that trouble or that issue going on, and by doing that, it forms scar tissue that's there. So what do we do for somebody who has trouble swallowing? Well, for me in the GI world, dysphagia or trouble swallowing is never normal. Let me repeat that again. It is never normal. So if food is getting stuck, you need to come see me so I can get you unstuck and get you taken care of. This is what's considered a warning sign when it comes to heartburn or acid reflux symptoms, and this is something we worry about. Other warning signs include vomiting blood, black stools, being anemic, trouble swallowing, or getting full very quickly, because these are signs that something bad is going on beyond the normal things. And one other reason in which you can have dysphagia, which I didn't talk about, is actually cancer of the esophagus. So over time, from chronic acid damage, you have the propensity to develop what's called Barrett's esophagus, which is a precancerous lesion, and that can, in some individuals, can progress to esophageal cancer. And so for my patients who have dysphagia, because it's a warning sign, I actually want to take a look and see what's going on. So we do what's called an upper endoscopy or an EGD, where we put you to sleep. I use a very small camera, and I see exactly what's going on. And with that, I can take biopsies if I need to. I can stretch out the esophagus if I need to. I can find if you have a hernia that may be causing your trouble swallowing, or at least get an idea of what's going on. And with that, not only can we find an answer. We can fix it, diagnose you, and get you taken care of. So, summary of everything. If you had trouble swallowing, don't ignore that. It is not normal for food to get stuck. It is not normal for food to slow down. It is not normal for things to get caught up in this esophagus area. Come see us. We can find out what's going on. We can get you taken care of. I can fix your issues so you can enjoy the food that you want and not have to worry about always trying to get that food out or having somebody do the Heimlich maneuver on you because you have something stuck in your esophagus as well. Let me know in the comments down below. Have you suffered from dysphagia? What has worked? What hasn't worked? Have you seen a GI doctor for this? Let me know in the comments down below. I would love to hear what you guys have to say. All right, guys, thank you for watching. Let me know if you're watching this on, live or on the replay. Also, let me know where you guys are watching this at as well. Adon, thank you for watching. Rebecca, thank you for watching from Ohio. So far, you're the winner for the hardest part. Blake, thank you for watching in the library. All right, that's good. And Alexa, once again, thank you for watching today as well. All right, next topic, IBS. Great questions. Hey, Dr. Issam, I have IBS and the holidays are coming up. What are my recommendations to get my IBS taken care of, at least managed during the holidays? So IBS, or irritable bowel syndrome, is a real condition. It's not in your head. You're not going crazy. I promise you. And millions and millions and millions of people suffer from IBS. And I don't want you to feel like you're suffering alone, because the holidays can be a hard time to have a lot of these illnesses and a lot of problems because you're around family who may not be sensitive to your medical needs, or you're eating foods that can trigger your IBS symptoms to get worse. What is someone to do? Well, luckily, you're watching this video where your poop guru can give you an answer. So, tip number one, I want you to be mindful of your eating, or at least have mindful eating. So too many of us during the holidays, including yours truly, will just grab food and just stuff it all the time. That's what I do all the time. When you have IBS, you need to be mindful of how you eat, because it's going to sound weird, but how you eat actually makes a difference when it comes to your IBS symptoms. So to eat slowly, don't swallow a lot of air, have portion control, eat to getting satiated but not full, don't overeat. These things actually matter when it comes to bloating, distension, IBS issues, because how you eat and enjoying what you eat and doing it slowly actually makes a huge difference when it comes to your GI issues as well. So tip number two, I want you to plan ahead for your trigger food. So there are a lot of foods that can cause IBS. Things like dairy, gluten, processed foods, oily foods. These foods are not the things that you want to be doing when it comes to your IBS symptoms. So know what your trigger foods are and try to avoid that if you can. Or try maybe bring an alternative food that you can bring in that you can eat as well. I know it's hard to do this during the holidays, but you want to make sure that you can put all the stacks in your favor to hopefully control your IBS symptoms to get you feeling better as well. And then tip number three, try to find ways to manage stress. So holidays are the great time for family and fun, but also it's stressful because of family and fun. And we know that stress triggers IBS symptoms. It is called the brain-gut axis. There's a direct connection between what happens here and what happens in your gut as well. So the more stressed that you are, the more issues that you have, the more you're kind of around family who you may not enjoy their company, the more you're just going to reflect on your gut. And so try to find ways to manage stress, whether it's yoga, meditation, going for a walk, exercising, prayer, whatever you can do that is your stress relief. Use that as a way to hopefully manage your stress and get you feeling better. I'll tell you, you are not alone when it comes to your IBS symptoms, and these are things that I tell my patients to try to incorporate during the holidays to get their IBS taken care of, so they don't feel so bad, and so their symptoms don't control them, but they're able to control their symptoms instead. Try this, see if it works. Let me know what you guys think as well. All right, if you're watching for the first time, my name is Dr. Issam. Yes, I am your poop guru. My passion is to give you guys the best tips and tricks so you can live your best life. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter where you can get great tips and tricks as well. All right, next topic. Hey, Dr. Issam, my bottom hurts. Why does that happen? It's very common for your bottom to hurt. Here are 7 reasons why your bottom may be hurting and what I recommend to get that taken care of. So reason number 1 is that it could be constipation. So You know what I mean by this? If you're trying to poop out a very large poop that is hard and hard to push through, that's going to cause you to have pain in your bottom. It's just natural. Your bottom is not made to have big, hard, lumpy poop. So if you're having issues like this, try some magnesium, try some stool softeners, try some fiber. It's going to soften up that stool and get you feeling better. Reason number 2, very common reason, are hemorrhoids. So hemorrhoids are dilated veins in the bottom that can cause pain, bleeding, itching, and pressure, and it can cause a lot of discomfort as well. It is literally a pain in the butt. So getting these hemorrhoids addressed will hopefully allow you to not have that pain in the butt as well. Reason number 3 are what are called anal fissures. This is a paper cut in your bottom. Your rectum does not want any paper cuts that are there. It's a very sensitive area that can make it difficult to, it's just hard because it's so sensitive. And any small paper cut that's there, like a fissure, can cause you to have tremendous amount of pain. And that fissure can spasm and open up and spasm and open up. And that can make the spasm worse, cause your rectum to clamp down, which will make pooping worse, which will make the fissure worse. It ends up being a vicious cycle. So if you have a fissure, we can check for that and give you a nitroglycerin ointment to relax that sphincter so it doesn't clamp down and cause worsening issues as well. Number 4, there could be skin conditions in the bottom that are separate from hemorrhoids or fissures that can cause you to have pain, whether it's eczema, psoriasis, maybe even proctitis, or even a yeast infection. These are very common skin infections in the bottom that can be examined with an exam by a healthcare provider, in which you can provide either medications or creams to relieve those symptoms and to get you feeling better as well. Number 5, you may have a condition called inflammatory bowel disease, specifically ulcerative colitis. So ulcerative colitis is a disease that always affects the rectum. That can cause inflammation, ulceration to occur, and it can cause symptoms in the rectum as well, including rectal pain. So sometimes we can see this whenever we take a look with a colonoscopy or even a flexible sigmoidoscopy, in which we can see the ulceration and inflammation can occur. Number 6, to be honest with you, cancer. Absolutely, rectal cancer and anal cancer can present with rectal pain. So don't ignore this. If you're having these issues, come see a doctor to find out exactly what's going on. And then lastly, certainly STDs. STDs, or sexually transmitted diseases, can certainly cause you to have rectal pain as well. So just be wary of that. So if you're having rectal issues, what can you do? So first thing you need to do is go see a doctor, because any of these 7 things, or all of them, or even more than these 7, can be the cause for your symptoms. Number 2, your doctor needs to do a rectal exam to visualize what is going on. So sometimes with the rectal exam, we can see what's going on. We can check for fissures, skin lesions, maybe even hemorrhoids. Number 3, you may need a colonoscopy so we can further see what's going on. Keep in mind, our rectum and our hands and our eyes have only very limited value when it comes to the rectal exam. And so sometimes doing a colonoscopy or even a small little scope will allow us to better visualize what's going on. And then lastly, if you have hemorrhoids, get them fixed, because we can resolve the issues and hopefully get you taken care of as well. So I hope this helps out with anybody who's having rectum issues, because this will hopefully allow you to feel better, get you taken care of, and get you feeling better as well. All right, perfect. All right, let's go through some of the questions here. Christina, thank you for watching. It's always great to see you on our channel as well. So let's go through some questions here. So Adnan asks, sorry, let me do this again. So Adnan asks, is pooping in the morning normal every day? Absolutely. Hey man, I poop in the morning every day. Not a problem. I'm happy. I'm proud. You should be proud as well. So don't worry about pooping in the morning, because I do it. Your poop guru does it, and so it is perfectly normal. All right, let me see other questions here. So Alexa asks, you were told you have atrophic gastritis. How is it diagnosed, and is it curable? So atrophic gastritis, which is it's a very specific condition. It's a type of inflammation in which you actually don't have the capabilities to produce a lot of acid. So in most cases, it's due to a condition called H. pylori. So usually we want to treat this and get this taken care of. And usually if we can treat the root cause, which is H. pylori, it can be curable. In some other people, it may be an autoimmune disease. And in that case, it actually may not be curable in that situation. So Christina asked a very good question. Hey, Dr. Islam, why do I get a sudden urge to use a bowel movement when I eat? Great question. This is called the gastrocolic reflux. This is real, it's legitimate. So this is actually one of the reasons why we recommend having something to eat in the morning whenever you're having constipation, because it triggers this reflux. So as you are eating, it actually helps to stimulate the contractions of your stomach, which passes the contractions down to your small intestine and to your colon. And so food, or the sight of food, or the smell of food can trigger this reaction, which causes you to poop. This is very common to occur. Whenever you eat, it allows the peristalsis of your gut from your stomach to your small intestine to your colon to propagate things through to allow you to have a good bowel movement. Very common reason, very normal, and typically not a problem, but it's called the gastrocolic reflux. Great question. All right, perfect. All right, guys. I think that's all the questions we have today. I want to thank you for watching and listening today. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter, where you can get great tips and tricks as you're watching in today's video. And thank you for watching my PoopScoop Monday. Once again, I'm Dr. Islam. Thank you for watching. We do this every Monday. Come join me. Love to hear what you guys have to say. Love my audience. Love you guys as well. Have a great day. Thanks, everybody. Take care.